Hello everyone, welcome to Orthopaedic Essentials. Today we are going to discuss one of the most important topic from practical examination point of view, that is sliding traction. Before going ahead, let's have a look at the various modes of sliding traction and try to identify each one of them. Balkan's frame. It was described by Vatroslav Florsuch, a Croatian physician during Balkan Wars. It consists of monkey trapeze, vertical uprights, horizontal bars, and pulleys. Monkey trapeze is used for physiotherapy and personal hygiene, whereas vertical uprights, horizontal bars, and pulleys are used for various traction. What are the various tractions you can think of that can be applied through Balkan's frame? Buttocks traction. In this traction, skin traction is applied and a pillow is placed below the leg to keep the heel clear of bed. The skin traction cord passes over the buttocks pulley which is attached at the foot end of the bed. The foot end of the bed is elevated to apply counter traction. It is indicated in neck of femur fractures, acetabular fractures. Problem with buttocks traction was that lateral rotation of the limb cannot be controlled. Point must be noted that no splint is applied in buttocks traction and in Perkins traction. In Perkins traction, skeletal traction is applied and the limb is kept over the pillow which is coupled with active movement of the injured limb. Perkins believed that early muscular activity not only maintained muscle extensibility but also caused fracture site compression, therefore preventing stiffness and promoting union respectively. It is indicated in trochanteric fractures, subtrochanteric fractures, fractures of tibia. In case of fracture of tibia, the Perkins traction is applied through calcaneum or distal tibia. Hamilton-Russel traction. In Hamilton-Russel traction, there are two components, that is knee sling and a skin traction. In modified Hamilton-Russel traction, one must note that there in place of knee sling, a distal femoral skeletal traction is applied and in place of skin traction, a below knee cast is applied. Alright. Now, the cord passing through the knee sling, the cord passing from the knee sling passes over a pulley which is just anterior to the knee sling and rest of the pulleys are distal to the leg where the pulley C is fixed to the where the pulley C is attached to the spreader of the skin traction or it is fixed to the foot end of the below knee cast in case of modified Hamilton-Russel traction. You can see that through these two sets of traction, through these two sets of pulleys, the forces are one force acting in the direction anterior to the knee, another force is acting in the direction distal to the leg. There is a construction of parallelogram of forces which shows that the resultant forces is twice of the force that is applied and it acts in the line of the femoral shaft. It is indicated in fracture shaft femur in pediatric patients and in case of triple deformity of the knee. What are the causes of triple deformity of knee apart from tuberculosis? This is an OSCE question and VIVA question also. Think about it. 1990 traction. 1990 traction was given by Oblage. It is a combination of two tractions that maintain the hip and knee in 90-degree flexion. Traction 1 is the main traction unit which acts on the pathology. It is given through either distal femoral skeletal traction or proximal tibia skeletal traction. Traction 2 is a supportive traction unit which holds the leg in air. This can be given either by lower tibial skeletal traction or below knee cast. Often students confuse 90-90 traction with Hamilton-Russel traction. What are the indications of Hamilton-Russel traction? It is indicated in proximal third femur shaft fractures, subtrochanteric fractures, compound fractures where Thomas splints cannot be used, and pediatric femur fractures. Advantage is effective alignment of the proximal fragment and distal fragments. It reduces the proximal fragment which is in flexion and abduction with respect to the distal fragment which is in adduction. It is good for in case it is advantageous in case where there is wound in the posterior aspect of the thigh. Therefore, without disturbing the traction, one can examine the wound and can do dressing if required. The complications of 90-90 traction is that there is risk of growth plate damage, knee stiffness, flexion contracture of hip, neurovascular damage, and all other risk of skeletal traction. Agnes Hunt traction. It was given by an orthopedic nurse named Dames Agnes Hunt. It is indicated in fixed flexion deformity of mild severity, right? It is indicated in fixed flexion deformity of hip which are mild severity. How is it applied? First of all, through Thomas test, fixed flexion deformity in the affected hip is determined. Then both the hips are flexed to obliterate the lumbar lordosis. Then, while maintaining the hip and knee in flexion, plaster hip spica cast is applied to the unaffected lower limb and sliding skin traction is applied over the affected lower limb through sliding skin traction is applied to the affected lower limb over Thomas splint and the leg end is elevated. As the fixed flexion deformity decreases, the Thomas splint is lowered. After the correction of the deformity, the Thomas splint and the Agnes Hunt tractions are removed. Bryant's traction. Bryant's traction consists of skin traction in both the lower limb with cord tied at the end which is fixed to the overhead beam through Balkan frame. One must ensure that the buttock just clears the bed. That is, the buttock is in not contact to the bed so that counter traction is applied by the weight of the pelvis and lower trunk. After application of Bryant's traction, one must look, feel and move. We must look for the color of the foot, whether it is pink or pale. We must feel for the temperature, whether it is warm or cold, and we must move the foot for dorsiflexion to see whether there is pain on dorsiflexion or not. So by these steps, what we are doing is we are looking or we are checking for circulation. It was found that while there was no effect in distal circulation on prolonged extension traction of the knee in case of the children below 2 years age, there was precarious blood circulation in case of children between 2 to 4 years of age when prolonged knee extension type of traction was given, and there was no blood supply distal to the knee in case of children above 4 years on prolonged knee extension. Therefore, Bryant's traction is used in children below 2 years of age. It is used with caution in children 2 to 4 years of age, and it is strictly and absolutely contraindicated in children above 4 years of age. Bryant's traction is used for fracture shafts of femur. Alright. Modified Bryant's traction. Modified Bryant's traction is used in the management of, it is used in the initial management of those cases of developmental dysplasia of hip who present after 1 year of age. In modified Bryant's traction, initially we apply the Bryant's traction as we discussed before, and then we wait for 5 to 6 days to allow the femoral head to come opposite to the acetabulum. Alright, if we do not wait for 5 days and if we do not wait enough, the femoral head might not have come to the opposite to the acetabulum, and it may cause impingement of the head with the superior labrum of the acetabulum. Now, once the femoral head has come at the level of the center of the acetabulum, abduction is increased by 10 degrees every alternate day till 3 weeks or when hip is fully abducted. If the children is restless or is in pain, rule out vascular complications, and if there are no signs of vascular complications, there might be impingement of the head on the superior lip of acetabulum, which indicates that the femoral head is not opposite to the acetabulum. In such case, we have to decrease the abduction and wait for longer period so that the hip and the acetabulum are aligned, and then again we start abducting by 10 degrees every alternate day. So this was all about the important sliding tractions that are usually asked in practical examinations. Hope you were able to understand the crucial points. Try again to identify the various types of sliding tractions that are given in this picture. Thank you for watching. Hope these videos are helping you. Try to read from the textbook that is Stewart's after watching the video. This helps. And please kindly ask questions or any kind of confusion or suggestion in the comments. Thank you for watching. Have a nice day.